After your hip replacement surgery, you'll need a period of rehabilitation. This will start straight after your surgery. Your physiotherapist will chat to you about your setup at home, about your hobbies, and if you have any activities you would like to get back to after your recovery. This will help us to design your rehab specifically to you. Don't be worried about moving your hip. We encourage you to move as soon as possible to help prevent your hip from getting stiff. We will show you some exercises aimed at getting your hip moving so you can help to speed up your recovery. It's your responsibility to do these regularly throughout the day, as advised by your physio. We aim to get you out of bed as soon as possible, often on the same day as your surgery. Your physio or nurse will be there to help you when you get out of bed for the first time. This is really important as it helps your hip to heal and reduce the risk of complications like chest infection, pressure sores, and blood clots. It's likely you'll be encouraged to put as much weight on your new hip as you feel comfortable, but to start with, you will use a Zimmer frame to make this easier. The frame will also help you with your balance and make you feel more confident when walking for the first time. As you start to feel stronger and more confident walking with a Zimmer frame, your physio will encourage you to try using elbow crutches. Crutches will help you to walk more normally, giving you the extra support and balance you need. Try to increase the distance you walk with the crutches each day. We'll let you know when you are safe to start doing this by yourself. Please don't worry. If you are unable to manage with crutches, we will give you a different walking aid that makes you feel safe. Whilst on the ward, try to do your other exercises that you may have tried at home. These exercises really help to strengthen the muscles around your hip and help you get back to your day-to-day activities. Make sure you take time to rest between walking and exercising so your hip doesn't get too sore. Remember, listen to your body. Move your hip as far as it feels comfortable, but please always respect the hip precautions. When you're walking safely and independently, we will show you how to do the stairs. We will teach you a method that you will be able to use at home. The key is to lead up the stairs with your unoperated leg. Then, lead down with your operated leg. This will keep you comfortable and safe. You won't have to do the stairs if you don't have them at home, but please let us know if you would like to practice them for any other reason.
At this stage, we'll look at discharging you from hospital so you can continue your recovery and rehabilitation at home. You'll need to arrange for somebody to pick you up from hospital and take you home. If possible, position the car about a foot away from the pavement. The seat should be pushed back as far as possible and slightly reclined. Get into the car with your bottom first. Gently lower yourself onto the seat, keeping your operated leg out in front of you. If you can, lift both legs in together to avoid twisting your operated leg. To get out of the car, just reverse this technique. And we recommend that you shouldn't drive for a minimum of 6 weeks after your operation. For a short while, you'll need to adapt the way you do things. A helpful tip to make life easier, try using a bag to carry items like food and a drink when using your crutch. You'll know when you're ready to try using one crutch around the house. It'll be a natural progression and there's no right or wrong way. It's entirely up to you, but most people will use them for up to 6 weeks. You'll probably feel you'll need to use your crutches when you go outdoors for a little while too. Remember, you must stick to your hip precautions for 12 weeks and use your grab stick to avoid bending, twisting, and for picking things up like your post, putting clothes into the washing machine, or if you have pets at home, your grab stick is ideal for picking up the food and water bowls. Accept help from family, friends, or neighbours. for shopping and putting your rubbish and recycling bins out for collection. Remember, this is only for a short while until you're able to get back to doing these things for yourself.